Socialized healthcare. Isn't it about time that we get on board? People have been praising that system for years.
In these countries, like say Canada for instance, they live 3 years longer than we do, and that's in part because they have a universal health care system.
But if you don't pass universal health care by July of 2009, in 6 months, I'm going to use my power as president to take your health care away from you.
Canada has a single-payer system. The good thing about single-payer is the administrative costs are quite low.
Clearly, the United States needs to join the rest of the industrialized world with a real national health care program.
It is underwritten by the government. It's free for everyone. You never have to worry about it costing anything.
So I decided to put it to the test. No, really, I went to Canada. Oh, Canada, the land of strong beer, funny accents, the slightly larger Cadbury egg, and free drugs. At least that's how the American media would tell it. Heck, even our own president wants to move us in that direction.
As president, I will sign a universal health care plan into law by the end of my first term in office.
Which is why I've decided to go through the socialized Canadian healthcare system with a couple of my favorite Canadians to show you exactly what it's really like.
Hey, I'll live with you for a week.
What? No.
That's Tim, my longtime best friend and a born and raised Canadian. He likes long walks on the beach and Wu-Tang Clan. He brings the ruckus to the ladies.
Oh my God.
And that's John, my other best friend. He just happens to have a Canadian Medicare card as well as a lot of free time on his hands, so he was perfect for the job. Now, it's important to know that this was all done guerrilla style. Unlike other filmmakers armed with full crews and scripts, we wanted to get true, authentic reactions and show you folks what it's really like to get treatment in a socialized healthcare system. So the audio and video might be a bit raw, but you're probably watching this for free anyway. So shut up. All right, first things first. We wanted to head down to the local clinic and see what kind of treatment we'd get there. But it was the weekend, and as people in the emergency room later told us,
So I guess the clinic is closed on Sundays or weekends. Weekends, it says. I guess we're gonna have to go to the hospital. Tim, time. Okay, so it's 1:06, and we're going to the hospital now in Quebec. Let's see what that's like. Come on.
Not super urgent, so the clinics are closed. So we wait? Okay.
So we were told to grab a number. Yeah. 770. I don't know how long that'll be. This is what? What'd you call this?
Triage.
The triage? Let's show. Okay.
What does that mean? Triage. That means we wait and we get judged by the nurse and decide how important we are.
Excuse me, can you tell us approximately how long the wait's going to be?
2 hours or 10 hours.
So between 2 and 10? Oh, she's going to tell us? Okay, thank you.
until finally, we got to see the nurse.
English. What's the problem?
I hurt my wrist skateboarding.
You can move it?
Yeah, but I get numbness just to make sure that nothing is wrong.
Nothing is serious. You want to make sure you have to wait your turn.
Yeah.
I'm not a doctor. I'm just taking the, all the...
Sure, yeah.
Your relative in?
I'm his partner.
So a lot of waiting today.
So which days are usually the shortest or the longest days for waits here?
No day.
No?
All day night. All day and night.
It's always long?
Yeah.
Yeah. Can I have one of those gloves?
No.
No? Just I want to do no? Can I have a glove? For the rooster head, you know what I mean, where you blow it through your nose?
No.
Okay. So no glove?
No glove.
Thank you.
Okay.
Now, once you see the nurse, of course, you have to wait again for a doctor. And as a lady at the front desk had told us, that could take a while.
It's been an hour and a half so far. We just saw the nurse. And they're about to send us to, well, now we're just in another waiting room waiting for the doctor. And they can't give us an idea as to how long the wait's going to be, between 2 and 10 hours. So now we wait. We'll keep you posted.
So we waited. And waited. Until honestly I realized that PJTV doesn't pay me enough.
All right, so we just left the hospital. We had been waiting for, say, at least 4 hours, and a guy with a broken clavicle who was in there, it took him 5 hours for a turnaround to finally get his care, and they finally couldn't do anything. They just told him to go see an orthopedic tomorrow. And there was another guy in there who was waiting 9 hours for penicillin, so considering that Tim had a what we thought might be a broken wrist, he wasn't such a high priority, and we were not going to wait around for 9 hours today. But we'll give the clinic a shot tomorrow.
Now, granted, emergency rooms can always be really tough to deal with. But what if a Canadian wanted to get something simple done, like a blood test? Well, it just so turns out that John wanted to do just that. He wanted to test his cholesterol levels, but doesn't have a family doctor. We went to the local clinic to find out what he needed to do.
Just in line here for the clinic. Waiting to get into the parking lot.
And of course, more long waiting ensued, but this time we came prepared.
Oh man. Screwed up backwards.
Pansies.
I spot with my little eye something that is red.
I spy with my little eye something that is
sexy.
Oh, found it. Is this real life?
Until finally, we were able to see the nurse. At least this time she was friendly.
So why you come here today?
I was looking to get a blood test.
No, don't do it. Don't do it here. No.
I can't get a blood test here?
No, if you're sick, maybe we can see if we need that, but no for for...
Well, he doesn't need a blood test here. He needs to get a slip.
Yeah, can I get a
blood test at the CLSC?
Okay.
And he doesn't have a family doctor.
Okay, because if we ask the blood test here, the doctor that prescribes blood test need to make un suivi. C'est quoi un suivi?
Yes,
need to give, you need to be your patient. Okay?
Right, but it's hard to get a family doctor,
yes,
and he doesn't have one.
But the only thing that you can do is just call the phone number. No?
I did.
Okay, and just ask how the clinic, if they have family doctor, and give your name to the list that they have.
I did that like 3 months ago.
Yes, but maybe it's like 2-3 years.
3 years to get a doctor?
But you're young, so you have the time. Normally they don't have problem at your age.
They suggested I get a family doctor, but that's what I was calling for. And
yes, now you need to wait. So, or you go in the clinic privé.
Okay. Is there one near here?
Yes.
That's where you have to pay?
Yes, it's 900 cost for you have a health checkup. Okay.
Okay.
And with that...
$900?
Yes, 900.
Wait, did she just recommend what I think she did? Paying for better health care?
What if I went right now to a CLSC and I couldn't just wait?
Sure.
No?
I'm not sure because the doctor that they have there, they have the patient that they need. So
They don't want any more patients?
you can try, but I don't. And you live where?
Greenfield Park.
You live in Park?
Yeah.
So where do you see? Let's see. Wow.
There's one in St. Lambert.
Okay.
Yeah.
You can try, but I'm not sure. But they do. Okay.
Okay.
Well, you heard her. We didn't want to wait 2 to 3 years to see a family doctor, so we decided to take our chances at the CLSC. Who knows? Maybe some Canadians get lucky, right?
Okay, to see a doctor here is between 9 and 12. Friday that we are closed.
Okay.
Yeah, it's always Monday to Friday.
Oh, skunked again. Looks like we'd have to wait another day. So we managed to fit it in within their ridiculous hours, only to be told...
So you haven't had any doctors here for...
3 years ago, Longueuil, Candiac, Brossard, St. Hubert, none.
Why?
Ask the government.
The government? No doctors, what, they don't pay, it's not enough money here?
I don't know, but if you have cash someday, you will have a doctor. Going this way.
Some days if you have cash.
That's it.
Oh, well, I appreciate your honesty.
Because we went to the clinic and I waited and I saw the doctor there and she said, well,
you see a doctor here.
Yeah, or see a family doctor.
Go there, come here, go there. But there's a private clinic. Would you like to pay?
Wait, hold up. A government employee recommending a private clinic?
So, believe it or not, after all of this, the lady upstairs, as you just saw, referred us to a private clinic. She seems to think that would be a little more efficient than the Canadian government, but As we said, that goes against the rules by which we're playing right now. We want to experience the kind of healthcare that Canadians pay for with their tax dollars. So the quest continues.
You know, maybe we were just the odd ones out. I've got a face with a lot of punch appeal, so maybe people might not be likely to give me the best treatment. So we decided to check with other fellow Canadians to see the kind of treatment they'd received.
OK, merci beaucoup. Premièrement, c'est quoi votre nom?
Diane.
Diane, OK, Diane. Et c'est quoi votre histoire ici avec votre mère? Je comprends qu'elle avait des problèmes avec sa jambe.
Elle avait des problèmes au cœur, elle avait la jambe bloquée à droite. Okay. Ils ont passé par la gauche pour la débloquer, mais ils ont bloqué la gauche aussi. Fait qu'ils ont été obligés de couper les deux jambes.
Les deux jambes?
Les deux jambes.
Donc maintenant, elle n'a plus de jambes?
Non. Non, je sais pas, c'est pas, c'est une erreur. Elle aurait dû être opérée il y a 1 an, mais ça n'a pas été fait. Il a entendu, fait que n'a plus.
Ça a pris 1 an pour eux?
Ça a pris 1 an avant qu'il l'opère. Wow. Fait que là 1 an, peut-être qu'elle aurait une jambe en moins, peut-être, mais pas 2.
Wow. Fait que parce qu'elle avait besoin d'attendre, c'est peut-être la raison qu'elle a perdu ses...
C'est toujours l'attente, puis regarde, on n'a pas le choix, on passe chacun notre tour. Regarde, en bas, résonance magnétique, là, j'ai vu des gens en résonance magnétique, là, ils peuvent pas avoir les traitements maintenant parce qu'il manque le stuff pour aller dans la machine pour voir. Wow. C'est une question de produit, c'est tout. C'est pas une question de sous, c'est le produit qui vient d'ailleurs qu'on n'est pas capable d'avoir. On est en 2009. Là.
C'est tragique, puis c'est même plus tragique parce que il y avait des autres options si ça aurait été fait.
Il y a 1 an, oui, il y aurait eu d'autres options il y a 1 an, oui. Là, maintenant, à la dernière minute, comme ça, il n'y en a pas eu d'autres. C'était, on essaye de débloquer, mais ils ont bloqué l'autre. Puis ils ont coupé même la jambe en santé avant la jambe malade.
Wow! Avant la jambe santé.
Oui, avant la jambe malade. C'est vraiment, c'est comme ça. Puis je pense qu'on n'est pas, je suis pas tout seul dans ce cas-là. Promène-toi là-dedans, puis il y en a beaucoup sûrement. Tout est gratuit. Là. On va voir après ça les chaises roulantes, les ci, les ça, qu'est-ce qui va suivre, l'adaptation du logement, la chaise roulante adaptée, le lift, là, si on veut, la chèvre pour la transporter, c'est ça.
Et si ça serait possible, on dit d'acheter l'assurance maladie privatement pour avoir cette opération en moins de temps, est-ce que vous l'aurez pris? Est-ce que vous l'aurez prendre cette option?
Bien, je vais te dire, bien franchement, là, en dernier lieu, là, quand je suis venue ici, si il y a 1 an, j'aurais su que c'était opérable puis que ça n'aurait pas arrivé, qu'est-ce qui arrive là, on aurait payé, je pense bien, oui. Okay. Oui, c'est sûr que oui. Parce que moi, j'ai un chien, là, puis je vais faire une prise de sang là, chez mon vétérinaire. Là. Ça prend 15 minutes, ça me coûte 10 $, tu vas dire, puis j'ai le résultat.
Et c'est privé?
Oui, bien c'est privé, c'est un vétérinaire. Je serais prête à donner 10 $ pour une prise de sang, ouais, mon résultat tout de suite, moi. Wow. Ça désengorgerait, là. Un petit $, c'est pas grand-chose.
I was at work and we were ripping down some stuff, doing some demolition, and I stepped on a board that had a rusty nail, and I went to the clinic, and I waited, and then when I saw a doctor, they said they ran out of tetanus shots and to come back Thursday. I didn't go back.
What day was it when you actually went in?
That was Monday.
Did they know that you had stepped on a rusty nail?
Yeah, I told them I stepped on a rusty nail, and I guess that didn't matter. Maybe I should have sat on it or something to get their attention. I don't know what I could have done. I have no idea.
You mentioned that Hayden was pretty sick and you had to take her to the hospital. What was wrong with her and what did they do about that?
She had a gastro, and normally it lasts 12 hours for babies, but for her it was going on 2 or 3 days. So we were getting worried. She was very lifeless and lethargic. So we took her to a hospital, and we ended up waiting 7 hours before they saw her. And when they saw her, they just said she has gastro, and they sent us home. But when we took her home, her fever got really bad, and we were getting scared for her. So we took her to the Children's Hospital, where there we waited 2 hours just to see a nurse. And they ended up keeping us for almost a week. So at the other hospital, they just generalized her. They didn't actually look into her symptoms or see that she was really sick. They just sent us home. And that's what happens a lot.
Okay, so, but 2 hours, actually, that's really good, even for baby emergency.
That was just to see the nurse, though. And then we had to wait after to see a doctor, so. I'm sure because they see a lot of children with gastro that they didn't actually listen to that she was sick for more than the normal time for a baby to be sick, so yeah, it happens a lot with a lot of people.
You have to see sometimes a specialist, a dermatologist. What's that like?
Well, basically, you would wait anywhere from 5 to 7 months, and it takes maybe maximum of 3 or 4 minutes to get diagnosed and get your prescription. And if that doesn't work, which in my case I just went to clear up my skin, and it didn't work, so I have to go get something else. But it takes so long that I just it's kind of discouraging to make an appointment, so I just end up not making one at all. I would have to make one right away as soon as I saw that it wasn't working, but sometimes you don't know if it's working or not until later on, so it could take a good year and a half to actually get the right kind of medicine for what you're needing.
And there are millions of other stories like these out there. Consider that the average wait time to see a specialist in Canada is 17.3 weeks, and that as of 2008, over 2.8% of the country's population are on waiting lists to receive special treatment, and there are bound to be a few unhappy campers. The truth is that these horror stories are so common because the Canadian healthcare system is overburdened, and because of its inefficiency, is underfunded. To keep healthcare spending to a minimum, they have to ration it. But at least it's free, right? Well, not really when you take into account the average income tax that someone in Quebec, Canada would have to pay. Do these numbers look ridiculous? They should. The truth is that a huge amount of tax is required to keep the system afloat because, like all government programs, it's proven to be terribly inefficient. Even Claude Castonguay, the man who headed the government commission in Quebec that led to creating this system, has declared it a crisis and has acknowledged the need to eliminate the government monopoly on healthcare through allowing more privatization. So while we're heading their way, Canada is starting to head ours. Oh, I almost forgot. The sales tax in Quebec is always over 12% and actually over 15% in some of the other provinces. Actually, it's worse than that. Let me show you how it works. See, in Canada, there's the federal GST, which right now has been thankfully reduced to 5%. Then each province adds their own provincial tax, like the Quebec QST, which is a little under 8% here. The problem is that the provincial tax is only added on top of the goods or services after the 5% GST has been totaled. So you're essentially taxed on tax. Taxed on paying taxes? What? Really? Well, I guess it's not really fair to just look at numbers and statistics. Because as everybody knows, socialism creates a safety net that allows for poor people to have a higher quality of living in all other areas of life, right?
How much is a sub in the States?
$5 foot long.
See, you know the jingle.
I thought it was $6.
Varies. So what would the theme song be here?
$8.99 foot long. Plus tax, high tax.
Actually, going back to Canada, I noticed that everything, even before taxes, was far more expensive. Just compare the Subway sandwich shop receipt to what you'd pay in the United States. The truth is that everything seemed more expensive in Canada. It wasn't uncommon to find things with a 30, 40, or even 50% higher price tag than in the United States.
At least gas is cheap. Yeah, when I left it was, I don't know, in California it was close to $3 a gallon.
That's liters.
It's what?
Liters.
It's liters?
Liters.
Okay, so the average price of gasoline in the USA at the time of this filming was just shy of $2.64. Fitting 3.79 liters into a gallon would average the Canadian gas price somewhere around $3.83. All right, the day was getting long and all this math is getting boring. Because math is for suckers, folks. So we decided to take the rest of the day off and celebrate Canada Day!
How do you feel about Canada, sir?
Fine. This Canada is beautiful.
I think you said it's a beautiful country. And something about a planter's wart. You got the horses going? Go Canada.
It was good times. All right, so now we know about the socialized healthcare system, and I know what you're asking. Well, what would be wrong with having both socialized and privatized at the same time? Well, the problem with that is that you end up creating a two-tiered system where the only people who can get decent healthcare are the super rich. Now, you remember what the nurse at the clinic told us.
$900 cost for you have a health checkup.
And with all of the income tax and ridiculous sales tax and expensive cost of living, the poor and middle class in Quebec don't have that kind of money to burn. The rich will always be able to afford the privatized, better health care, whereas the average Canadian is going to have to continue to wade through an ever-deteriorating system that they pay for whether they want to or not. If they want privatized healthcare, that would be comparable to an American having to pay for two separate private insurance plans. See, when you remove choice from the equation, it's always the middle class who gets piped. So do you still think that Obama is moving us in the right direction here? Be sure to let me know what you think below. Now, on the other hand, if you're actually concerned about the state of socialization that's coming our way, be sure to pass this along and take an active role by writing letters to your congressmen and women. Oh, and by the way, we never were able to actually get that blood test. We ended up just doing it at home.